It's a weekly Facebook broadcast that we bring you right here on the Nebraska Medicine Facebook page, taking on a different timely health topic every week with one of our experts. And this week, we're talking about school and sports physicals. We're out here at our Elkhorn Health Center with Riki Rutz, who's a physician assistant. Thank you so much for joining us today.
Yeah, thank you. Happy to be here.
Lots of good questions and timely questions. Before we get to those, a little disclaimer. This is for informational purposes only, just a little chat. If you have any questions specific to your health or medical condition, go ahead and direct those towards your doctor. Or if you need a doctor, I've got one for you. So school just got out for a lot of us, and like thinking about the next school year is maybe kind of far off. But really now's the time to think about taking care of those annual physicals, sports physicals. Why are annual physicals important?
Yeah, so in annual physicals or well child checks, our focus is on wellness or prevention of illness. So we address things like immunizations and nutrition, physical activity, safety, and definitely monitor growth and development over those years too.
So you're looking at things like we're used to. You're checking their height, you're checking their weight, we're checking their eyes and their ears. But why is it so important to look after some of those other things as far as like developmental delays or any issues that maybe aren't just tied to their growth?
Yeah, so it's important as we see them and get to know them. We do kind of general screenings in terms of development and behavior issues. But I think it's important to know too that there's a range that's normal and appropriate for certain ages. So if we see them regularly and maybe there is a concern, we can get them set up with the right resources or people that can help them a little bit. But most of the time there's nothing to be too concerned of.
Well, an advantage is to seeing the same provider every year because then you get to know the kids and then you feel comfortable. What do you say to parents that might be nervous about asking questions about something, like maybe they see other kids the same age that are hitting a milestone and they're lagging behind?
Yeah, I mean, like I said, I tell them that there's a range. If they're, not exactly like another child their age, they'll probably be there soon. Or maybe there is an issue and we can address hearing or speech or behavior or things like that if there are concerns that may not be entirely normal.
I think when it comes to immunizations, all of us that have had little kids are used to the rounds when they're babies, but those continue through childhood, and that's important for people to not forget about. So what's required once kids hit those older ages, those elementary school ages?
So prior to entering kindergarten, kids get their second dose of like MMR, which is measles, mumps, and rubella, and then they also get a second dose of a chickenpox vaccine, as well as usually a Tdap and polio. And then kind of the second time that we do routine immunizations in school age is before 7th grade. So we do some shots at 7th grade and then some additional optional shots too as they get older.
You mentioned the MMR shot, and obviously measles are a hot topic in the news right now. And some people they're not really sure what to think. What do you tell parents when it comes to vaccinations, and especially making sure if they want to protect their kids from measles, that they're getting the proper amount of doses?
Yeah, so, vaccines are very effective. And so specifically with measles, since you brought that up, after getting one dose, which is usually given at age 1, it's thought that they're about 93% effective. And so then they only get one other dose, which is before kindergarten. And after that second dose, the immunity actually goes up to about 97% and really stays with them lifelong. So they're really effective. They are monitored regularly for safety, and any side effect might be a little tenderness at the spot where there was injected or ickiness or something for a day or two.
I think as parents, we were happy to hear numbers. If our kids bring home 93s and 97s on their report card, so it's a pretty convincing statistic. Kids obviously have to come in for those required immunizations before kindergarten, before 7th grade. Why is it important to come in every year?
Yeah, I mean, I think we also address other issues too. We sit down with the patient, we do a full head-to-toe examination, but talk with the patient and their family about any other things going on, safety issues or maybe social concerns or school issues that maybe we can help with, or maybe mood problems, feeling depressed or things like that, that doesn't really come out unless you come in or mom and dad bring up concerns about that too.
And that's that advantage to building a relationship with your health professional, so that you do get to know them and you feel comfortable and that you can see changes in the kiddos too.
Right, yep.
What age range of patients do you see?
Well, in family medicine, we see all age ranges. We see babies through end of life, so anybody is welcome here.
Is that one of your favorite things about your job?
Yeah, I love the variety. Yeah, it's nice.
Let's switch from school physicals to sports physicals because there is a slight difference. And then I also want to remind anybody who's watching us on Facebook now, or even if you're watching this later and you have a question, feel free to go ahead and type that in the comment section below. I'm trying to keep an eye out, so if any of them come in live, we'll go ahead and get those to Riki. But if we don't get them to her live, we'll circle back later and get you answers to any questions you might have about your kids' health or anything related to family practice. Sports physicals, who needs them and how is it different than an annual physical?
Yeah, so sports physicals are required for anyone who's participating in a school-sanctioned sport. Also, though, there are some rec leagues or club sports and things that require a sports physical in advance. What we're really looking at, I mean, we address all the same things as a school physical or an annual physical, but we're also looking a little bit closer at heart problems or any symptoms they might have with exercise, chest pain or dizziness or shortness of breath or any maybe specific heart problems that might be in their family history that might pose some risks. So really we're just making sure that they're safe to participate.
Kids are playing sports, I think, younger and younger these days. So at what age should you start looking at those kind of things? I mean, I don't think necessarily my 6-year-old needs it for t-ball, but...
Yeah, I mean, I think it's, in general, the level of exertion just increases with age. And so, I mean, again, we see them annually, so we can kind of identify some of those things early, but really it's as they get older, 7th grade, or participating even in Boy Scouts, which are sometimes more high adventure activities too. So
sure, I wouldn't even think about that. Another question for you. You're a physician assistant here at the Elkhorn Clinic. Some people might wonder what that means, or what's the difference between a physician assistant and a doctor.
So, you know, in family medicine, if you came in to see me, you might not notice much of a difference between seeing a physician. There are certain things that physicians can do that I can't, like for example, you know, if they're delivering babies or things like that. But in general, most of the procedures in the clinic or prescribing medicines and all of that stuff, I do as well, just like the physicians do.
And for patients of all ages, so I think it's important to point out as we're taking in our kids for these annual physicals, it's important for adults to put their own. You're not necessarily watching the growth curve for us as much, but why is it important for people of all ages to get an annual checkup?
So, you know, again, prevention of illness and keeping people well. We talk about nutrition and physical activity, but we also do screening for certain cancers at different ages, and sometimes blood tests and, you know, family history if they're at risk of anything else. So it is just good to have good baseline of what's going on with your health now, things that you don't maybe have symptoms for, of high blood pressure you wouldn't know unless you come in and things like that. So again, prevention though is kind of the best, and coming in regularly, we can make sure you're up to date on all of that stuff.
If people want to come out here to the Elkhorn Health Center, we're located right by Elkhorn South High School, a beautiful new facility. What kind of patients do you see here?
We see patients of all ages, so lots of, you know, little kids, teens, up through adults. So,
and even if they're having issues with illness or anything like that, so you can come in, you can schedule a regular doctor's appointment, take care of those physicals, or maybe I think this time of year, I think it's like round 2 of allergy illnesses right now. You're probably seeing some of that.
Lots of allergies.
Any more advice that you would offer parents as we're kind of getting into the busy part of the summer and preparing for the next year? Because things, I think it flies by. You're a mom of 3, and you know how fast time can go. About what we need to watch for with our kids' health, and advice that you would give to your parents and patients.
I mean, I would just say making sure that they are getting some activity and eating well, and you know, those are really the best ways to stay healthy. And come see us if you need us, and if you get sick, we're here for that too.
Not popsicles all day long like my children would like to eat during summer vacation.
That's okay though.
So, right, it's important. It keeps them hydrated.
Balance.
All right, thank you so much for your time today, Riki. And that's the other question I have. If you have a physician assistant, what do people call you? Do they call you
Riki?
They call me Riki. There you go. So if you want to schedule an appointment with Riki or any of our other health professionals at any of our clinic locations, you can start at nebraskamed.com to explore our locations all across the city. You can also schedule an appointment with your phone. You can call 1-800-922-0000. Thank you, Riki, for your time today.
Thank you.
Great information. And even though summer just started, it's time to think about it now, get it scheduled, and get it out of the way. We appreciate it.
Thanks.
You bet. And we'll see you